Hello once again and welcome back to my YouTube channel. My name is Alotte and I am a physical therapist. This video is part of the series for management of back pain or neck pain due to poor posture. The last video that I demonstrated to you was about some exercises for the neck part and then the upper back, in order for you to be able to keep that chest a little bit more open and strengthening the muscles on your upper back. Now, in today's video, I am going to show you three stretches that you can do for the muscles here on the neck, particularly the scalene muscle, and then the sides, which is your levator scapular muscle and upper trapezius as well. Just to let you know, I want you to be very careful when you're doing these stretches, as they may be difficult for you to go through with it, or that you may be experiencing some increasing soreness, or if you don't feel soreness right away, you probably may feel it like 2 to 3 days after, which what we call DOMS, or the delayed onset muscle soreness. And that probably may be a little bit unwanted for you, okay? If you are new to this channel, please consider subscribing, as most of my videos that I'm showing is part of a series for a specific body part that I am targeting. And also hit the notification bell in order for you to be notified when I have new videos that is being uploaded. So without further ado, let's just start with. Okay, so the first muscle that I am going to show you that I am going to stretch is the scalene muscle, which is found right here. Okay, so when you look on this side here, the big muscle that you can find is not the scalene, but that would be your sternocleidomastoid muscle, where both can bend your neck forward, or you could also turn your head and push it that way. Now, the back part of the muscle is what we call the scalene muscle. The only reason why I mention this muscle specifically is because this muscle is potentially going to pinch nerve as well, that is coming out from your neck and give you that abnormal sensation towards your arms. Okay, so what you are going to do first is to tilt your head a little bit more towards that side, and then turn a little bit like 45 degrees that way. And then what I'm going to do is to make sure that I am counter pulling that pull that I'm going to do with this this hand. So there. What you're going to feel is a pulling sensation right on this muscle here. Okay? Now, like I said, this could be very uncomfortable for anybody, especially if you have a very long standing forwarded posture, because that muscle will get really tight. And if you're going to do that like right away, push your head back like very fast, all the more that you could irritate that muscle, and it may constrict that nerve that I was just talking to you about. Okay, so let's do it on the other side. I'm gonna bend it this way, and then turn a little bit like 45 degrees, counter pull by this arm here, and then I'm gonna pull. Okay. Now this part of my scalene gives me a little bit of sensation with head, tiny bit of pain here, and then a little bit of sensation at the back. Because, well, you think I'm a physical therapist and I don't have bad postures. I do as well. As sometimes if you're right-handed, you use these muscles a lot, and then I use a lot as well on the computer. So I do have some tightness as well on this muscle. And pretty much it's not equal on both sides because I don't feel that on this side, I feel that more on this side. Like I said, be very careful when you are doing these stretches. Now the second muscle I am going to stretch is what we call the levator scapulae muscle. Now the levator scapulae muscle is pretty much like situated on the side because it's pretty, not really like on the side, but it's like originate a little bit more on the upper part of the shoulder blades, and it's attached to the bones of your neck. Okay, so but I will still consider it as like more on the sides. How I do that? Just we'll do lateral flexion. So counter pull. It is very important for me to counter pull because it is easier for your head to just go this way, especially when it's painful. So I need that counter pull to stabilize your shoulder, and then you could do that stretches. Okay, this one I will just do straight and then gently pull to the side. Right, I feel it stretch. Okay, and then if I do it to the other side, I'm gonna do it like this. Ooh, there it is, very tight. Okay, so you just probably will, like I said, you probably will just do the motion first without really holding to start with, especially when you are really slouching for a very long time. Now the last muscle that I'm going to show you is pretty much a combination of a levator scapula and also the upper trapezius. Now the upper trapezius is pretty much the muscle is attached here and more on the top of your, pretty much like top of your shoulders. These are the muscle that shrugs your shoulders, okay? So, okay, this one is what I call the sniffing your armpit exercises. Because it's if like you are sniffing your armpit. So look at your armpit. Again, counter pull. And then you're just gonna pull your neck towards the armpit. You should feel that pulling sensation right in here. Okay? I'm going to the other side. Armpit, counter pull, and then the other. Now it's really, really tight as well on my part. Okay. Those are the 3 important muscles for this series. And on the next video that I am going to be uploading, still about addressing poor posture. So please don't forget to subscribe on my channel so you will not miss this video that I'm going to do next. Okay, bye-bye!